This is the mode or a part that I think modern technology is really fueling at the moment. So I think we've all got a little bit of this anyway, innately. But I think that modern technology is just kind of making it a lot more difficult for us. And what we're talking about today is the undisciplined child mode. Welcome to 7 Minute Schemas. I'm Rita. I'm a clinical psychologist and an advanced schema therapist supervisor trainer.
And I'm Ruth Holt, and similarly an advanced schema trainer and supervisor. Yes, Rita, it's a really interesting mode, the undisciplined child mode, which can already set some people's teeth on edge. Maybe it can feel a bit judgy. But when it plays out in people's lives, it's such a difficult mode. It's a side of self. It's a child mode, remember, that can come from perhaps not having had needs met in terms of encouragement or in terms of help somebody sitting alongside, helping you to learn that persistence and sitting with discomfort, working towards a goal. When you haven't had those needs met, you end up with an undisciplined child mode. And so you can let a whole lot of things pass you by because I just don't want to, or I can't be bothered, or I just don't even care. Have you experienced that in clinical practice, Rita, that people can get really stuck in those undisciplined child modes? And how does it play out?
Well, I experienced it at home with my children not wanting to do their homework, and it's just a kind of a classic example of, having to do something boring that's not fun. They'd much rather be on the Xbox or something to that effect. And, trying to help scaffold that boredom and that frustration of doing something that you don't see is worthwhile in the moment to get to an end goal, and that is part of that undisciplined child mode that the early caregiving environment attempts to scaffold. But yes, I think, and I do see it clinically, and it really is quite distressing for people because there is this innate part that wants to do these things, but this real block in being able to do them. And it doesn't necessarily mean that the individual was spoiled or, something to that effect, and that's why they don't have the discipline. There's a number of different reasons on why this particular child mode is more developed in adulthood than it could be.
Yeah, so it can be really hard to complete boring or annoying tasks, maybe just even the everyday getting up, brushing your teeth, kind of sitting through annoying lectures to get to that end of that degree, or starting at the bottom of the rung. It's like, I just don't want to do that. I just kind of would like things handed to me, or kind of somebody else might do them for me. And that's really interesting, right? Thinking about what are some of the schemas that might be fueling this mode. One of them could be an incompetence dependent schema, right? A sense that there's an other out there that I really rely on, and I haven't really been taught to be independent and autonomous. In my relationship structure kind of needs me to be in that less than position, that kind of, oh, I look to you and you do it for me. Maybe there's a real bond that has formed with a caregiver or a partner, and they kind of do life for me. Other schemas, do you think, Rita, that might fuel this undisciplined child mode?
I think just on that, it could be a little bit of enmeshment in terms of, sometimes I've had individuals where it was modeled, the lack of discipline. So not engaging in boring tasks or setting kind of manageable goals, having kind of this intrinsic motivation to do things. So sometimes it can be a bit of modeling or a selective internalization of that way of organizing their life.
Mm.
But it could also be things like defectiveness shame that you were saying earlier as well.
Yeah, I think that's a really interesting one, right? So when you've got a really strong critic that says, you don't deserve a life, what do you mean? You're worth something? You're not worth anything. Then that energy just gets sucked right out of you, right? And you sink into perhaps avoidance, detachment, and also a side that's like, I just don't want to do it.
Yeah. And I guess so in that instance, we're kind of looking at that kind of vulnerability, how it's connected to kind of vulnerability and other parts around critics and vulnerability, as opposed to kind of more autonomy needs. But you can see that it's a mixture of perhaps there's these kind of attachment needs that weren't met, and then you've got these autonomy needs that weren't met as well, that kind of contribute to this lack of discipline. I'm not quite sure, Ruth, whether you've had individuals that might have this mode and you find that sometimes it comes out in really all or nothing ways. So sometimes they might set goals and go really hard and then all of a sudden burn themselves out and not be able to continue with that. So there's this kind of all or nothingness sometimes that can happen as well. Whereas discipline really, in the true sense of the definition, is this idea of kind of small chunks, frustration tolerance over, endurance almost.
Yeah. And one of the things we talk about in our training is actually doing some imagery work with these kinds of child modes. So really floating back from that, oh, can't be bothered, or I don't want to, or just the sort of draining going out of you, floating back from those types of experiences back to childhood, and in imagery meeting some needs. So perhaps coming alongside and saying, I know it's annoying and I get it. I mean, you know what? Why don't we do 5 minutes and then we go and jump on the trampoline and then we might do 5 minutes more. So providing those needs in imagery, which is very different, right, to something like imagery rescripting, maybe for vulnerable child. But again, it's meeting the needs. It's giving a corrective emotional experience to people that then in the present will help that healthy part of them to be that, gentle cheerleader, or that break it down little bit by little bit, and then start getting some wins so I can start to feel like maybe I could do things.
Yeah, that's a really good point. And I think sometimes a therapeutic relationship also helps, kind of individuals really connect with that part of themselves, really kind of understand the internal narrative and dialogue that's connected to that part. And together with the therapist, finding a way to get that strong, healthy part to be the stronger force, if you like, when I've got to do those boring things, like the 5 piles of laundry that I need to fold after this, Ruth.
Well, let me encourage you, Rita, to move into your discipline and getting those tasks done. But if people would like to hear more about ways to help really understand and work with clients who have undisciplined child mode, we've got some training at the end of this video.